Hi, Paul Sakis, Good News Planet. I'm speaking to Dr. James Tsai. Hi, doctor. How are you?
Hi, Paul.
Chairman of the Department of Ophthalmology and Visual Science at Yale University, and SCOTT CHRISTENSEN. Hi, Scott. How are you?
Hi, Paul. How are you?
Good. President and CEO of Glaucoma Foundation, and we're going to urge Americans to take action to know their eyes. Millions of Americans are living with glaucoma, but may not know they have it. Okay, why don't we start medically here? What is glaucoma, doctor?
Glaucoma is a disease where you can lose vision. You can lose your side vision initially, and then you can also lose your central vision. The important thing about glaucoma is that oftentimes there are no symptoms. There's no eye pain, there's no vision loss, so that's why the public needs to schedule comprehensive dilated eye exams where the optic nerve is looked at and the eye pressure is measured.
Okay, and if they are negligent on this, what can happen?
Well, what can happen is they can develop irreversible vision loss. So the important thing is to have the glaucoma detected early so that effective treatments can be started.
Okay, let me another question then. What is an effective treatment?
Effective treatments are ones that are tailored with the patient. They can include eye drops, lasers, or incisional surgery, all to reduce the eye pressure.
And are they quite effective?
They can be very effective, especially if the drops or the lasers or the incisional surgery is tailored to the patient. So that's the important thing, for the patients to know their disease and to tailor the right treatment plan with their eye care professional.
Aha, okay. So is that their eye care? Is that, I mean, you go get a pair of glasses and they usually have an eye doctor there. Is that person, or is this now an ophthalmologist?
Well, both ophthalmologists and optometrists can treat the disease and can make the diagnosis of glaucoma.
Okay. Scott, I wasn't ignoring you. I'm crazy about you.
No, that's fine.
Okay. President and CEO of the Glaucoma Foundation. So obviously you guys are getting the word out about eyes and the importance of eyes. You have a great take on glaucoma website here. So tell us about what your outreach is.
Well, our outreach from the Glaucoma Foundation perspective is basically twofold. We have a mission primarily to fund cutting-edge research, which we're very proud to do and have done that for many years globally. And we also get the word out as far as education for appropriate and timely eye care and information about glaucoma in particular. But what we've done here is to obviously partner with several organizations for this Take on Glaucoma initiative, because what we want to do is to educate the patients about the disease and also about the timely examinations. Because one of the issues, I mean, first of all, around the world right now, there's 60 million people that have the disease, and it's projected to be 80 million by 2020, which is obviously a significant increase. And given the fact that age is one of the key risk factors, and we have the aging baby boomer population at this point, we're going to see a much greater incidence of the disease as we go forward. But again, unfortunately, at least 50% of the people that have glaucoma are not aware that they have it.
Why, doctor, why do we think we have it? Why do we think how do we get it?
How do we get it? Well, we get it for many. Oftentimes there's a family history component to it. If you're African American or Hispanic, you're more likely to develop glaucoma. If you're over the age of 40, as we age, our risk goes up. If we're nearsighted, we also have an increased risk. And if we have a reason to have elevated eye pressure, that's also a risk factor. So there are many different risk factors for developing glaucoma.
Paul, one thing I might add to that,
Sure.
which I think is a very important point that Dr. Tsai made, is the issue of elevated intraocular pressure. We've understood for many years that was a risk factor, but what we've found in the last 5 to 7 years is that, in fact, a person can have glaucoma and have regular pressure or low pressure, and as a result, it may or may not be diagnosed. So again, that's part of the Take on Glaucoma initiative, is to educate the patient to make sure that when they go see their eye care professional, that they have a fully dilated eye exam so that the eye care professional can look at the optic nerve and determine its health. So it's important that the patient insist upon that dilated exam.
Are people, sometimes people don't get the kind of treatment that they probably should because they're either scared or they're not sure what's going to happen. Do you think there's some potential fear, that puff in the eye or the dilation that might be out there that people are concerned about? Is that
Yes, I think
make any sense?
that's a concern for patients, and I think the important thing, and they can go to the website takeonglaucoma.com to learn more about their disease. The good news is, even though there's no cure for glaucoma, there are effective treatments, and people should really not fear the disease, because once a disease is diagnosed, it can be effectively treated, and hopefully they will retain their vision throughout their lifetime.
Another important point to add also, I think, is that with any health condition, it's important for a physician to establish a baseline. And so if the person goes to see their eye care professional and finds that everything is fine, that's excellent, but that gives a comparative baseline for the future. The other thing that's important to understand is that the eye is a window to the rest of the body. And it's a situation where an eye care professional can determine that the eye health is fine, but they may notice something else of concern and then refer that patient to another specialist.
Scott, let me ask you this, because I'm sure you're probably connected somehow with this. How does insurance here deal with eye interests?
Basically, they are well covered. It really depends upon the individual plan, and obviously, what the risk factors are too. But the bottom line, honestly, is that I think that the various health plans realize that the cost of somebody going blind or becoming visually impaired is huge enough that they need to cover it. So it's generally well handled at this point.
That's good news. We just did a show yesterday with Cigna, and they were talking about all the preventive kinds of things that insurance. I was even surprised on how much insurance companies are really getting out there in the word prevention. So what they were saying is that a lot of people don't know that.
Yes.
Yes. It's important to have your eyes checked and examined because, as Scott mentioned, really this is a health priority for Americans.
Sure.
And so we need to make glaucoma a health priority.
Is this another one that we should put on our annual checkup list?
Not necessarily. Certainly one of the risk factors is age, and it has been determined by the American Optometric Association that if you're 40 or above, you should have an examination every other year, and once you reach 60, you should have it on an annual basis. But up until 40, unless there's significant risk factors, it's not necessary.
All right, so you can take the quiz here, undiagnosed, find out if you are at risk for glaucoma. Diagnosed, take the quiz, okay? Open someone else's eyes, okay? Send the quiz. That's a good thing, right?
Yes.
Pass it along, help each other. A lot of good stuff here. Okay, last question then. Doctor first, what's good news for you?
Well, what's good news for us is that there is this campaign, Take on Glaucoma. And it's Take Action to Know Your Eyes. And there's a website where patients can find out more about their disease and educate family members.
Okay, that's good. And we see that a good corporate citizen, Merck, came out and is assisting in getting the word out. That's good news. Scott, tell us what's good news for you.
Well, good news for me is that I believe not only with eye care, but with all patient situations, I believe the patients are beginning to understand that they need to take charge of their own care. They're trying to understand the situation. They're asking the right questions. They're not accepting things without question. And so I think that's a wonderful thing to see. I think it's also important to have a situation which we encourage as well, is to have family members be educated so they can be supportive of the patient.
That's a big one, always, in every medical condition, no doubt. All right, great job. Thank you very much for sharing this information. We'll send everybody over to the website, and everybody pay heed here. Thank you very much.
Thanks for having us.
Thank you.
Take care. Bye-bye.
Bye-bye.